Hello, everybody. Welcome to another Holistic Health Hour. This is Dr. Kevin Connors. Let's jump right into it. We have some questions that were sent in. All right. What is the difference between an allergy to food and a sensitivity to food? I think they're saying. So, um, it's really a matter of semantics to a degree. So, typically, a food sensitivity, it has to do with the different immunoglobulins that are uh, firing. That's a part of your immune response. When you talk about like a peanut allergy, that's an IgG, that's an IgE reaction, and that is more of an immediate immune response that can cause hyperinflammation and even lead to death because the person's airways can be blocked. But when we're talking typically about a food sensitivity, we're talking about a delayed response, an IgG response, and that is more of a delayed response. So food sensitivity to gluten, let's say you have IgG antibodies to gluten, um, that's not the same as full celiac disease. So if a person with celiac disease is exposed to gluten, can get such severe pain in their abdominal area that they could end up in the ER and could have quite a lot of damage to their intestinal tract versus somebody with an IgG reaction to gluten will have a ramped up inflammation that could be just as damaging um, systemically, but not as damaging specifically to the gut wall in something like an acute reaction like that. So that's really the difference. But for most people, it's more semantics. So when you go and you say, I like you're at a restaurant, is this gluten free? Now they say, is this an allergy or a sensitivity? The reason is that if you have celiac disease, they're not going to serve you anything because their kitchen isn't a pure celiac um, gluten uh, 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 clean kitchen. They have other products in there that have gluten in it, and maybe your food is going to be served with a gluten-free bread, but there's no guarantee that it's that something else wasn't fried on that same griddle that had bread that has gluten on it, and so you could still have a reaction if you had full celiac disease. So if you do have full celiac or IgE peanut allergy, you have to be far more careful. You can't even be around somebody with peanuts. Some people with celiac can't even walk, can't even go grocery shopping because they can't go in the bakery section because breathing in that the gliadin that may be floating in the air could cause a reaction and cause issues. So that's really the difference. So you should say if you did a Cyrex 3, 4, and 10, and you showed different food allergies, um, technically they're food sensitivities. I mean, technically you do have an allergy. You have antibodies to that thing, and it is serious. Um, but it's typically not immediately life-threatening. That's really what the difference would be. How do I decide between different products for phase 6 of the detoxification process? So if you haven't read my book, The 7 Phases of Detox, you don't know what this question is about. Phase 6 has to do with proper elimination. And in the book and in the course, I talk about different products that you could use to help with elimination. And it is a little bit of a trial and error because it is it if you are on the course, I'm not giving you direct advice as a patient because we don't have patients, we have members. So it is a trial and error, and it is about looking at other products that you might already have in the cupboard. I'm not here just to sell products. I don't want the courses to be just to sell products. I want you to look at the ingredients of the products that I recommend, and you might have a cupboard full of products already. Well, by all means, try to utilize those products, but understand phase 6 is helping you with the detoxification pathway, and, and phase 6 is helping you with elimination through that path in that piece of that pathway. Some mistakes that people make is I had somebody the other day ask me why I was taking an aloe product for my gut, and it was really helping me. Is it the same thing as the aloe that you recommend? When I had to look at that product that they were taking, it is not Cape aloe. So there is a lot of differences in the ingredients that might have aloe in the name, but it's the variety of aloe that's going to help with elimination. So just typical aloe, which would be aloe arborescens, can be very soothing for the intestinal tract. It can be very healing for the intestinal tract, but typically isn't going to be really helping with elimination. If you want help with elimination, let's say you're constipated, then you really need Cape aloe if you're going to pick the aloe product. It's a specific type of aloe. With magnesium, you have a little bit more leeway. Magnesium glycinate is typically the product that might be recommended by a lot of practitioners if you're dealing with constipation, because it can stay more in the gut and therefore draw more water. And that's the whole idea. So excess magnesium of any type, any variety, any type of chelated magnesium, if you take excess of it, it'll end up getting dumped in the gut, and that will draw water, and that will help with elimination as well. But we have multiple products that I recommend. Some people, their real issue is the deficiency in fiber. They're just not eating a lot of fiber-rich foods. They don't eat salads. They don't eat vegetables. It's just their habitual dietary pattern, and it's just a change in diet that can help. Sometimes you're adding extra fiber that is an undigestible fiber, which we typically recommend the Sun Spectrum or the Sun Fiber products. That could be the thing that really helps a person. Some people are constipated because they have an imbalance in their gut flora, and they really need probiotics. So I'm all for using any of these products to help with constipation, because you cannot be constipated, but you do want to dig a little bit deeper eventually at some point in time to look at, why am I constipated? You know, am I constipated because of my poor diet, or am I constipated because I have a lot of inflammation in the gut? Do I need to do some other testing to find out any sources of inflammation that I need to deal with? Do I need to dig to the reason why? And I think, yes, the answer is obviously yes. So do that, but do experiment. I can't tell you exactly what's going to be best for you. You do need to do some experimentation in this process as well. I have been taking berberine for 2 weeks, and for the past 5 days, I've felt nauseous, loose bowels, and cramping. I'm not sure if the berberine is the culprit, because the last time I took it, I had the same symptoms, but I did not. I did not make the connection then. Is there something else I could take? So berberine is a natural product that's in different foods. It's found in Oregon grape. It's found in barberry. It's found in a few other things. It's a great antibiotic to the gut. It's one of my favorite things. It can help lower blood sugar. It's great for people with cancer because it can help decrease glucose sensitivity on cell membranes. So it hinders the cancer cell's ability to take up glucose. It can help kill H. pylori, which is a common player in so many disorders. Really good for heart disease, berberine. So and cardiovascular disease. So I love berberine. I take berberine quite frequently. So, like anything, you can kind of have an irritation to it. So it can be good to pulse your products. Maybe just taking it every day is not the thing to do. Maybe you just need to take it once a week. Maybe you need to take it a couple times a week. Berberine might still be the right thing for you to take. Maybe you just, everybody thinks, you have to take your supplements every single day. So, and I might even recommend people take 2 a day of these. But the truth is that you kind of have to experiment with a little bit of pulsing your supplements. So by pulsing, I think I have an article about pulsing supplementation as a blog post on our website to look. You can search for it in the search bar of our website. The pulsing your supplementation means sometimes it's good to take it, just 4 days a week or 5 days a week, and you're going to take the weekend off. If you notice a sensitivity or a reaction to any supplement, then you can even pulse it a little bit differently. Sometimes people are actually having a tummy ache from the capsule itself. So you can open up most supplements, unless they're time release supplements. You can open up those supplements and put them in your smoothie. You could put them in some other drink. So I would try pulsing it before I would just discontinuing it. Can a person have a sensitivity to berberine? I've not known that. Anything is possible. Could you have a damaged gut border that it's just being irritated by berberine? That's a possibility too. Could the loose bowels and cramping because the berberine is killing off H. pylori or something, and it actually being a good thing? Well, that's a possibility too, but that's no fun to have. So pulsing it could be better to maybe just kill a little more slowly if that is the cause of this. We just don't know. You have to experiment with some of those things like that. All right. I hope this was a blessing to you. And we'll see you next time.